All right, welcome back to Central Valley Buzz, everybody. I'm Chuck Leonard. Billy, let's bring in our next guest, Eddie Davis from Auspice Home Care. What's going on, bud? How are you?
Good to see you again.
Haven't seen you since the last time you had me all in the gloves and the goggles and everything.
Virtual dementia tour, yeah, that was a lot of fun.
Tell people what Auspice Home Care does.
Well, Auspice Home Care is a non-medical in-home care provider. We provide caregivers to come out to people's homes, wherever they call homes. We help out with several things. We help out with activities of daily living, help out with medication reminders, help out with meal preparation, helping people with personal care assistance like bathing, dressing, and grooming. One of the newest things we just started is actually transportation assistance. We just picked up our 4th transportation vehicle, so now we're able to help people that are wheelchair bound, even gurney bound, to get to and from doctor's appointments, dialysis, chemo, even take them out of the hospital back home.
Shopping.
Right? Shopping, yes, absolutely.
So you guys do it a little differently. You're meal preparation. You're hanging out with them sometimes if they just need companionship.
Absolutely. A lot of our services starts off as companionship.
So do you have families calling you up, or do the people themselves call you up?
It's a variety. You know, we get people in crisis that call us in the hospital, and they get this list of resources, and you know, we're usually on that list of resources, and so they'll call and kind of find out what we do. You know, and I think that's the hard part for families is when they first call. They're kind of lacking a lot of information from the people that's given them those lists, and so they're kind of calling in crisis. And you know, families are calling saying, "Mom and Dad need to go back home," and they said, "I need your service in order to get back home." So I go out, usually meet with the families wherever they're at, hospitals, at home, in skilled nursing facilities, wherever they're at, and just kind of meet with them, determine what kind of services they're looking for, and then just kind of help put things in place for them to get where they need to be after that.
Because it's a tough transition, man. It's your mom, she's getting up in years. Maybe dad isn't around anymore, and you want to help them out, but you got to work and you got to pay your bills, and the time isn't there. And I'm sure these people feel horrible about it, but this is something that helps them feel a little bit better about it.
Absolutely. I think the most important thing is, you know, having the peace of mind that you're getting a good quality company in there to work with your loved ones. I think a lot of people get in crisis mode and they try to call in the neighbors, or they'll find a family friend that has a daughter or something like that going to school, and you know, they're probably well intentioned, you know, but those people don't have workman's comp for themselves. You know, maybe they want to file a W-2 at the end of the year. You haven't paid taxes on those people. Just a lot of things to consider, you know. And also, what if that person doesn't, you know, show up for their shift, or something, you know, disappears in the home? You know, that's where having an agency like us is having peace of mind for that.
And what if the parent needs more than that person can deliver?
Right, and that's where, you know, it's important to have, again, a professional company that trains their caregivers. You know, make sure that they know exactly what they're doing when they go in the homes, because a person's condition can change, you know, anytime, especially if folks with, you know, Alzheimer's and dementia. What works on Monday might not work on Tuesday, and you have to kind of change your approach around. So having somebody that's really trained in Alzheimer's and dementia care helps out a lot.
What type of people are you hiring?
We hire basically we look for mainly CNAs, certified home health aides, really people that are, you know, looking to make a difference in people's lives. We look for compassion. You know, you can't really train compassion. It's something that you're born with, I feel. And so that's one of the main things we look for is a compassionate individual. We do background testing, of course, the DOJ, FBI background testing. We do drug testing. We do personality testing, which is really important also. To kind of make sure these people do have passion for what they're doing.
What kind of things would you ask on one of those tests?
You know, it's outside the box questions. You know, one of the questions I like on it, it just kind of looks at how they think. So ask a question almost like an IQ test in a way. One of them asks, "What's heavier, a ton of bricks or a ton of feathers?" What would you say?
A ton's a ton.
Right, exactly.
Right?
But you know, you want to see if they're outside the box thinkers in those situations, or we'll talk about, you know, a person that you see in a kind of situation where they're, you know, maybe in need, and you know, how would you kind of interact with that individual? Would you just avoid them? You know, those kind of things. So it's really good testing on there. Other things that we do also is what we call Auspice University, which is a kind of a 5-hour testing that we go through and training with all of our employees to make sure they know everything they're doing when they go out to the homes.
You're kind of a young guy. How'd you get into this?
I actually kind of fell into this. My wife's grandmother's the reason I started doing this. I was kind of bouncing around from job to job. I was a social worker, newly married, and social work just was a hard job for me to really secure for a long period of time. I went back to school, and as I was going back to school...
Was there a reason for that?
Going back to school?
No, the not being able to secure the job for long periods of time.
The grants that they wrote, unfortunately, only made it to like October or November, and then I would get a pink slip around that time of year. So we didn't have a good Christmas the first 6 years. And I finally went back to school, and as I was going back to school, my little brother had called me one day and told me they were looking for a social worker in a skilled nursing facility. And I went and applied for the job, and next thing I know, I was working in a 85-bed Alzheimer's care unit. And I really had no clue what Alzheimer's care was about. So I kind of just learned from the people I worked around. Had a great group of people, some really good supervisors that really taught me and took me under their wing. And then my wife's grandmother started having problems at home and kind of found out that there was more to just that skilled nursing Alzheimer's care. Found out about in-home care and worked for an agency for a while, and then had the opportunity to start my own in February of '09. So we're fortunate enough to just celebrate our 6th year of business now. So.
I'm interested in when you went into this 85-bed Alzheimer facility, not knowing much about it, what the learning curve was like.
Yeah, that was, I think, the most important thing was having a good team of individuals around me and some great mentors. I had a director that was above me, and I had some great directors of nursing and, again, amazing staff. And within about a week of, really getting involved and getting your hands dirty, I pretty much went in and acted as a caregiver. And within that week, I was able to kind of get a little bit more of an understanding. And then as
was it shocking?
It was. It was really shocking because I had no idea what these individuals were going through. And that's where I really learned about, what the caregivers were going through, taking care of these individuals also. And so what I found was really important, helping the loved ones of, the patients, understanding what the caregivers are going through. So I do a lot of educational forums where they can kind of understand the difficulties the caregivers are, going through when they're trying to provide personal care and different types of services.
Because it's not like just taking care of a regular patient.
No, it's not.
It's tough.
It is. It can be very challenging.
It's frustrating.
It can be, and that's where I tell people, get educated on, how to take care of those loved ones. That's why I think it's important for people to reach out, get those screenings in place, find out if they have dementia or Alzheimer's disease, get educational support, find out, how to be a good caregiver, reach out for respite care, reach out for services like in-home care or assisted living that has respite services. Find out when you need to get those breaks so that way you can prevent caregiver burnout. Because, when those caregivers get burned out, then you have potential for abuse and neglect and things like that. So it's really important to get educated, get screened early. And that's one of the other things I wanted to kind of mention briefly was the screening processes that we're going to be providing.
How do they screen it?
Well, it's not really, it's not a diagnosis process or anything. It's just like when you go out to get your cholesterol screening or diabetes screening, you go out to like your pharmacy or, your CVS or what have you. And they do their cholesterol screenings there. Well, they're not telling you have high cholesterol. They're not, diagnosing you with anything. They're just simply saying, based on this test, you should probably follow up with your healthcare professional, see what they think about it. So the testing that I do is 4 different tests that have been thoroughly screened to, kind of let them know, you don't have dementia or Alzheimer's, but based on what this test shows, you should follow up with your healthcare professional. Rule out if it's something else. It could be a thyroid issue. It could be, a vitamin deficiency. It could be too many medications that you're taking. But go talk to your healthcare provider so that way they can really see what's going on. And, most of the cognitive evaluations I've done has been just to rule out, medications they've been taking too many of. So it's a good tool.
What are some of the things you're asking?
Well, some of the things that we ask them are just, simple things, but it's important at the beginning to kind of find out, like their educational levels, because there's some, math questions that you ask them in here, and if they don't have, basic elementary education, they're not going to do well on these tests. There's recollection question and answers you ask them on here. So some of the things I'll ask you is maybe I'll give you an address of a person. I'll ask you a couple of other questions in between that. I'll ask you to, recall that address and give it back to me. Some of the other testing on here has simple math questions, asking 3-point commands, asking for you to, take a piece of paper, fold it in half, place it back down, onto the table with your that hand, just different things like that to see how the brain's working. And then based on those tests, we have different scores on those. And then what I do is I basically give all that information to the family afterwards. It's all confidential. I don't keep any of the information. I don't keep their name, nothing like that. And I just tell them, based on your test, I think this is something you should probably follow up with your healthcare professional on. It's all confidential. I'm giving it all to take with you. So it's up to them.
Now, if people need to get a hold of you, how do they do it?
Give us a call. Our phone number is, of course, 559-436-4782. And then, of course, I know our website usually comes up on there, but that's www.auspicehomecare.com.
All right. You guys at home, give Eddie a call. He's a good guy. Hey, we're going to take a quick commercial break. When we come back, we're going to start the second hour of The Buzz. Stick around.